So again, the treatment is we focus on what the problem is. Okay, since the problem has to do with the bladder neck and the sphincter being in spasm, that's what we focus on. In the old days, we used to stretch or dilate women's urethras. Some of you may have had that done, or maybe you know people that have that done. That's an old-fashioned way to treat the problem, and I personally don't like to do it unless it's the only way we can fix the problem, because it hurts. And it can cause scar tissue, and it can cause urinary tract infections and other things. So I like to do a kinder, gentler method and use medications. I have to use two though, because the bladder neck is made of smooth muscle and the sphincter is made of skeletal muscle. So they're different structures and they have different receptors and they respond to signals from the body differently. For the bladder neck, I use a medicine called Flomax, which was actually invented for men who are obstructed by their prostate. And I always tell people that because even today, if you read about it, you Google it, or you pull out the package insert, it's going to talk about men and the prostate, and it's going to say do not use in women. That's because it was approved for men and it was never studied in women, but we use it in women all the time. We actually use Flomax in people who are passing kidney stones too, because we know it will dilate ureters. For the sphincter, I have to use a muscle relaxant. The one that I think works the best is a very, very low dose of Valium. Just 2 milligrams before you go to bed is enough to break the spasm in the sphincter without making you sleepy, sluggish, or tired during the day. Now, I can't use Valium if somebody's on another nerve pill. So if someone's on Xanax or Ativan or something like that, then we skip the Valium. But I use those two together, and if that's the problem, within 2 to 4 weeks, the problem will be better.